And it also will affect our solid health. We get on the trees and
No to the tyranny! Hey, don't you have any friends on the west side anymore? No to tyranny!
Well, at least he showed his face. That is brave. Yeah. That's a lot of nerve.
One turf!
People would get upset and try to say,
no to the lies! Don't do it! Don't do it! Tell the truth! Tell the truth! Tell the truth! They're doing just the opposite of this. This is all about government control. It's all about socialism. It's a Fabian socialist agenda. All these things that are all about government control.
Just out of curiosity, the article you're referencing?
Oh, okay.
Where's that from?
This is the American bubble machine. Let's see here. Let's see what's further back here. CORRENTE wire.com.
Do you believe that healthcare should be a basic human right, or be considered a basic human right?
Yes, but it's like anything. It's what you earn. The thing is, people think that the government is a money pit or a money tree, that there's endless amount of money. Well, they can keep printing up money, but at some point we lose. It's just a fiat currency, and when we act irresponsibly, at some point the dollar could collapse and it become worthless because it's not based on anything but debt.
If government's a basic human right, then why shouldn't everyone be covered?
Because in countries that do have national health care, it doesn't work well for most of them, or a lot of them. Like for example in England, there's a lot of people, they can't get dental care on a timely manner. They end up with terrible dental problems which lead to other health problems. One of an important preventative care is actually taking care of your teeth and gums, and so they can't get that on a timely manner, so then sometimes they end up going into emergency treatment and very deathly ill, and it can actually kill you. And there's people that actually end up pulling out their own teeth because they can't get the care that is promised to them by the government that they don't get on a timely manner. And delayed care for a long period of time is denied care, is the reality of it.
And a lot of what you're talking about is, government-run health care, but nothing on the table right now that's been drawn up in any of the House bills that came out of committee or in the Senate have nationalized health care or single-payer health care as an option. Mainly the public option is what is being circulated, which is being said to exist alongside the private insurance.
Well, that's just a lie. I've seen videos. In fact, I watched one just today where these socialists have said that this is just, they're going to present it this way to pass the bill and to impose it on us, but it's all about government monopoly of health care.
And who said?
And Obama was one of the people that said this before the election, repeatedly. This is just an absolute lie. They lie about everything. They lie. They say carbon dioxide is a pollutant. They lie and say that all the economists agree that they need bailouts. They lie when they say that there's global warming. There was over 31,000 American scientists and climate professionals that said, no, this is a lie. There's no man-made global warming. We've got record cold temperatures here in this last month. You know, it's cool out now. Over the last 600 million years, we're actually at a low percentage of amount of carbon dioxide.
And you said they're lying. That
Absolutely, they're lying. Because it's a fraud. It's any fraud. That's what they do, is lie. They say one thing and do the absolute opposite.
So let's say a bill passes with a public option, and there will be a public option, you know, alongside of the private insurance companies.
But that's not what this is. It's right here. You can read the bill.
But that is what's being proposed is a public option.
That's what they're saying, but that's not what it is.
So that's not
they're lying.
that's not really what's in the bill.
Or virtually everything, you know, and it's just you know, and see, they'll promise anything. That's what there was a Soviet Union spy that defected into our country about 25 or 30 years ago.
So, rolling it back once again, you know, to healthcare. Let's say something existed where, you know, you could choose to do government-provided insurance, or you could choose to do nothing and go with any private insurance company of your choice. If that true choice existed, that would be something that you would be interested in seeing? Because you mentioned competition earlier, right?
I'd consider it, you know, I mean, if it's done properly, yeah, but as long as they're not, you know, shutting off private care, but that is what's in this. I mean, it's about gradually, or over a period of time, and a lot of it just shutting it down, you know, and that's what they've stated their purpose is. You know, a lot of this stuff, it sounds good. It sounds like good intentions, but you know, the pathway to hell is paved with good intentions, and this is how these socialist revolutions have happened in these different countries. Is they misinform people and they promise them all these utopian things that are not realistic. The reality is, it's the production of goods and services, people working, is what provides our prosperity.
And I'll just ask you one more question, then I'll let you go.
Okay.
And this is only because it's been in the news so much as of late. Do you think Obama was born in the United States? You think he's an American citizen?
I don't know, but I think they should find out. And if he's not born American, they should. Well, and there's a question about it, so it should be investigated. And if he's not a natural-born citizen, then he should be removed from office because it's illegal.
Even though he already produced his birth certificate.
Well, that's a lot of people indicate that that's a fraudulent birth certificate.